Top Med Talk.
Well, hello and welcome to Top Med Talk. We're coming to you live from the Windy City, Chicago, Illinois for the annual meeting of the American Association of Nurse Anesthetists. I'm Desiree Chappell, your host, normally joined by my co-host Monty Mythen and Saul Aronson, but they couldn't make it on this trip. We miss you guys dearly, but we had to forge on. So I'm flying solo for the trip. No worries there. We have some surprise guest hosts over the next couple days, so stay tuned. Now, I'm also here representing NorthStar Anesthesia as their Vice President of Clinical Quality, and we really do want to thank them for supporting Top Med Talk to be here at the AANA. We are on the booth. I'm sure you can hear we are live in the exhibit hall. It's day one. You can hear the buzz and the excitement. We see some friendly faces who are over here heckling. The crowd's heckling us, I think. Now, the AANA is our professional organization for certified registered nurse anesthetists here in the U.S. I myself am a CRNA. Excited to be here. This is the third year that Top Med Talk has been at the meeting to have conversations with phenomenal CRNA representatives from around the country. So we're going to do more of that. We really want to get into this conversation that I was able to get some of our team together from NorthStar to sit down and continue a conversation that we actually started during the pandemic. Last minute, the AANA got canceled. We had to go online virtually. So NorthStar leadership had a Facebook Live that we were doing on women in anesthesia. We wanted to continue that conversation here at this meeting. And so sitting down with us, we have Jennifer Squibbs, who is one of our Vice President of CRNA Services. We have, Chris Hendren, another VP of our newly appointed VP of CRNA Services at NorthStar, and Jennifer Harpe-Bates, who is a CRNA that I am privileged to work with downtown Norton Hospital for NorthStar. Ladies, thank you so much for joining us.
Yeah, thanks for having us.
All right. Well, I want to take just a minute to give you guys an opportunity to introduce yourselves just a little bit more. So, Jennifer, I'm going to start. Jennifer Squibbs. We got two of them here, so forgive me if we.
It's a good thing.
Yeah, it is. We can always use more Jennifers. Tell us just a little bit more about yourself, your practice, and the leadership that you have here at NorthStar.
Yeah, thanks a lot. So I currently serve as Vice President of CRNA Services for Ohio, Pennsylvania, Delaware. We have great teams in the region. I've been with NorthStar for 11 years, very proud of that. And excited to always represent women in leadership and excited to talk about it.
Yeah, Jennifer, this is something that's been near and dear to your heart for a while. We've been having these conversations.
So it is. The possibilities with NorthStar are endless, and I really want women to know that you can balance all the demands that we have. I'm currently raising 3 children, with my husband. So very busy and still being able to meet the demands of the job. So
And we can get into this in a little bit later about how NorthStar is really leaning into this and doing what we can to support women specifically in our profession. So Chris Hendren, tell us a little bit more about yourself.
Yes, I've been with NorthStar since 2016. I started as a staff CRNA, then progressed to chief, then regional, and most recently been promoted to vice president of CRNA services. So I cover Kentucky, Tennessee, and Mississippi. Just very excited to be talking about this. This is a very important topic, obviously, as a woman working in anesthesia. So working for NorthStar has been great and very supportive in that role. So I'm just excited to be talking about it.
Yeah, and I think it's great. So I'm, again, privileged to be able to work with you on the team in Louisville, Kentucky, and in our region in Kentucky. Chris, you as a woman in leadership, I think it's been a really great opportunity that NorthStar has supported you over the last several years, bringing you up kind of through the ranks.
Yeah, absolutely. Yeah, to be able to start as a staff CRNA in 2016 and now just, a few years later to be promoted to vice president, I've had a lot of mentorship and a lot of support. NorthStar does an amazing job of supporting leaders and really developing us. They've really, like you said, leaned in to leadership development. So it's been a wonderful journey for me.
Yeah, fantastic. And Jennifer Harpe-Bates.
Yes, I've been a CRNA for 30 years, and I have been with NorthStar for the last 6 years. So I've worked over the span of raising children, getting them through college, and now they're married. And
now you have grandbabies.
Now I have grandbabies, and I have evolved over that time into different roles. And I'm also clinical, self-appointed, as I call it, clinical leadership. And
you're not any self-appointed now.
Now I'm one of the quality directors at Norton Downtown and NorthStar Anesthesia.
Jennifer, you've seen a lot, I'm sure, over the course of 30 years, and the varying degrees of support of women within our profession. Now, it seems like, and maybe you can start us off with kind of a historical perspective at least in our little, microcosm of the world in Kentucky.
Yeah.
But your experience of, what it was like being a woman starting out and starting a family in anesthesia, because I think it's a little unique compared to maybe some of the other nursing or medical professions.
Yeah, I think that's right. I mean, I think back, my youngest son is 25, and I think back to being pregnant with him and on call in-house in the hospital, straddling a CT scanner, intubating someone with a gown on and pregnant, and all the things you don't want to do, but you have to do because you're the provider that's in-house.
Yeah.
And you make provisions, you make do, and you read and worry, that you've done something to harm your child, but you get through that, and you put on your mom hat when you get home and start homework and dinner and practice, and you just have to learn how to switch hats and do it, and you can. It just takes some effort, and you have to have good support from your spouse.
Yeah. Shout out to Jennifer's spouse who's here with us.
He's my support team.
That's right. I love it. I might take my husband with me around.
I know you do.
So,
I know.
Got to have them for sure.
Exactly.
So I guess the landscape has changed a little bit, though, over the course of time.
I think it has, because I felt like, to be frank, I never planned on saying this kind of thing, but I felt like my pregnancy was inconvenient for my employer. It wasn't NorthStar then, for my employer, and because they had to make so many special provisions for me and things like that. I felt like it was an imposition, and I don't think women feel that way anymore when they're pregnant. We have rights, we have things that we should be allowed to do, and time to do those things. It's just more accepted and appropriate now. That we get the time to do what we need to do to be moms and still be at work.
Yeah. So I think that there are some challenges that we can go down multiple rabbit holes on this one. One of the things that the four of us have all experienced at this table, working in the nursing profession and as a CRNA, as being a mom, unique to maybe the situation. In anesthesia for our group, I started in a small group, right? It wasn't a large national company like NorthStar is. I didn't have anybody to backfill if I had to leave on maternity leave. There was no one. And so it was looked upon as an imposition, but it was also like, to keep this group running, we're a small independent group. There's still a lot of those around. I think there's more conversation about how we support women in kind of all different settings. Jennifer, I wanted to start with you. You are leadership for, hundreds of CRNAs, I suppose, and probably hundreds of women CRNAs. How do you feel like your role as a leader has been to be able to support our women in anesthesia? Not necessarily just moms, because not everybody's a mom, but everybody kind of, women bring their own unique perspective.
So a lot of my focus is on leadership development, encouraging more people to step into leadership. So what's important to me is that people understand that you don't have to give up your family or whatever you like to do in your life to be a leader. Recently, I've just been in quite a few conversations where we see someone who has potential and talent. We want to provide them the numerous opportunities we have. And the feedback is like, no, I'm not ready. It's not my phase of life, or I'm going to start a family instead. We as a company support that. So what we really encourage is having open discussions with your manager, having the mentorships in place so that we can all ascend and practice to our full scope of practice, but then also practice to our full abilities, even if it's in leadership too. That's what's unique about NorthStar, is potential opportunities out there we wouldn't normally think of.
Yeah.
So that's what I get excited about. We've just recently kicked off our clinical leadership conferences again, which were very successful in 2022. First time we were all together as a leadership group.
Almost 300 people that attended the meeting.
Incredible.
Yeah.
We put that together, had numerous courses on the business of anesthesia, leadership training, and then what really liked the best about part of what we did was called Thought Labs. So we wanted to break down the barriers between presenter and attendee so that we could hear from our clinical leadership. They could present our challenges of the company, how it's operating out in the field, and then our corporate leaders were there so they can really get a lot of good feedback on things that maybe we can improve, system development, or making the life of a leader easier so that they can get that balance.
So whenever you have women who are interested in leadership, what are some of the things that you're telling them about how to, prepare themselves and their families to do that? And I guess we probably need to back up a little bit and talk about what being a leader within NorthStar specifically entails?
It starts with being the example in your group, coming in ready to work, engaged every day. We all come with different things from home or from our personal life that's challenging, so understanding how to turn the switches kind of on and off. But what we mentioned, even spouses, the support system that you have behind you is really important. I wouldn't be able to be here without the Army to help take care of home while I'm
Village, I always say.
village.
It's my village.
So very thankful I have that, and that's it. But it doesn't always have to be a spouse. Definitely my parents are a big part of what we do, friends and family of any kind. So trying to find those support systems and building that for you personally also helps.
Yeah. I mean, I think those are really important points that you have to have in conversation with people who are interested in leadership. Chris, as a leader, because you've been a chief, you've been a regional director, and now a VP, what do you feel like are some of the biggest challenges that women in anesthesia kind of have to deal with now, kind of in 22? Jennifer kind of gave us a historical perspective. But what do you see are some of the biggest things that women say right now are barriers to either just doing their job or leadership?
I think a lot of the things really do come from home because, kind of to expand on what Jennifer was talking about, men are a lot less likely to say, I don't want to step into leadership because I have young children than women are. Although I do think that's changing. I absolutely think that's changing.
Men are becoming more.
Yes. Yes.
As we sit here with four of us who have very supportive husbands.
Yeah.
But I definitely think that men are becoming a little bit, having that mindset change.
Yes.
Where they're really, maybe a little bit more focused on home, and that balance between what the mom and the dad do at home is a little bit more fair and a little bit more even. So I do think that that's one thing that's changing for sure. So, I think it's so important to support people who are interested in leadership, especially in women. So to be able to say to them, listen, NorthStar is very supportive of you having that work-life balance. They want you to be able to do the work that you do that's so important to lead your teams, or to even be just a clinical leader within your own group. It doesn't have to be formal, but NorthStar is very supportive of that and wants to make sure that you have that balance and are not killing yourself at work to be a leader. So that's one of the things the company's really focusing on right now, is making sure that things are sustainable for our leaders. How can the corporate office take some things away from the clinical leaders and make it a little bit easier to do the day-to-day job for things that are just mundane, repetitive things. So I think that working for NorthStar has been really great in that, and you really do feel supported. And I think that's very important, especially for women in leadership.
Yeah. Let's talk about our staff CRNAs, because I think that not everybody wants to be a leader, not everybody wants to be a chief. We're trying to develop a pathway for leadership and quality. Not everybody wants to do that. Some people want to go to their job, show up, do a great job. They're all in during those 8, 10, or 12 hours, but they want to go home. Sometimes that's a challenge whenever we have the staffing issues now. Chris, I'll start with you. How are we as NorthStar kind of addressing some of those things? And Jennifer Harpe-Bates, I also want to give you an opportunity I know that these are some things we've had conversations about our local shop, but...
Yeah. So I think during and after the pandemic, we've really seen people shift the way they work and the way they think about work.
Yeah.
So we've had a lot of providers want to cut back on their hours. They are interested in going 1099 or going PRN. We can definitely work with that. NorthStar's great about being flexible. Mm-hmm. So to make sure that you are meeting the providers where they need to be is very important in order to retain them. Yeah. So I think, just having that perspective in mind, making sure that as much as you can, you're focused on taking care of the providers who are working that day, making sure they get their breaks, their lunches, that they get out on time whenever it's humanly possible. Now, we all understand that there's days where the OR is crazy and it's just, it's not going to work out. But if you make that effort every single day and the providers that you work with know you're making that effort, then, they'll forgive the time or two when they get stuck in the OR. So I think flexibility is really the key.
Yeah. Jennifer Harpe-Bates, I wanted to talk about, I feel like our shop downtown, Steve Edelin is our chief down there. He's done a fantastic job. There's a lot that has to do with culture when it comes to this. How have you seen a shift in culture from those days of being, in position, being, the difficult one because I'm having a baby, to what our group looks like now?
Yeah, I think that's a good point, and I was sitting here thinking about that.
Yeah.
So, our team downtown Norton, we are very supportive of each other, the CRNAs. So, if someone has an issue that they need to get out, say their kid's sick, we send each other messages. It can even, it's one of the guys. I mean, some of the guys, like, I want to go to the doctor's appointment. So my kid's sick. Can anybody move up the list, move down the list, trade me, let me out? And we just take care of each other, you know? So before, whenever you had to go home early because your child was sick, you had to call your MD staff and they had to make arrangements and it was a big deal and it would take 3 or 4 hours for you to get relief when you said, I got to go now. My kid needs to be picked up right this moment. And now we do that amongst ourselves. We take care of each other. And we say, the next person out, would you let me go because I have this issue? And we're there to support each other, you know, make it happen.
It's so important. Jennifer Squibbs, as someone who's been in leadership at NorthStar for a long time, you've probably seen kind of the evolution as well. Where do you feel like we are now in supporting women and moms and dads, really, for that matter? How have you seen the shift in culture work at your sites and within NorthStar as a whole?
So the pandemic, one of the good things that have come out of the pandemic is understanding and compassion for each other. So just as Jennifer had mentioned, being a little more receptive to needs outside of work. And I think we all have that perception of how it can affect your job performance.
Yes.
We want our teams to succeed. And that means every member of the team coming in and understanding that they work for a team who's going to support them and getting out to whatever life means for them. And we are seeing the shift. It is not only managing mothers and children, but families, growing families and families at different phases. So
absolutely. It is every phase. It's not just young kids. It's babies, parents and everything else. The whole gamut. Ladies, thank you so much for sitting down. I really appreciate you having this conversation. It's one thing that I'm very passionate about. I know the three of you are. I know there are many people within our organization in the field of nurse anesthesia that's, that this is a priority of discussion, and I hope we can continue it. So thank you very much. Thank you for everything that you do every day for our patients and for our clinicians.
And thank you, Desiree, for everything you do every day for us.
You're welcome. If you liked what you heard today, please be sure to share it. We are on all your favorite social media platforms, LinkedIn, Facebook, Twitter. We are there. TopMedTalk.com, Top Med Talk Podcast. You can find this as well as all the other amazing conversations we've had here at AANA 2022. Ladies, again, cheers to you. Now let's go have an awesome recruitment dinner and event and look forward to it.
Thanks so much, Desiree.
Thanks for listening.